I'm Dr. Sundar Gnanavel. I'm a consultant child psychiatrist working at Harley Therapy, and I specialize in neurodevelopmental assessments, including ADHD and autism assessments for children and adolescents. So I have around 7 to 8 years of experience now in conducting neurodevelopmental assessments for ADHD and autism. So I have been trained in different aspects of the assessment, including administration of questionnaires, interpreting assessments like ADOs, administering questionnaires like the ADIR, and I also have plenty of experience both within the NHS and in the private sector conducting these assessments. And I have always been quite active with the educational and research side of things pertaining to neurodevelopmental psychiatry as well. And I do have a number of published manuscripts in national and international journals pertaining to ADHD, autism, assessment, diagnosis, management, and various other aspects. And I think one particular highlight of my career has been I have won a number of accolades and awards pertaining to my research and educational activities pertaining to neurodevelopmental disorders, including from reputed organizations, including the Royal College of Psychiatry, the World Psychiatric Association, the European Psychiatric Association, and the International Association for Child and Adolescent Psychiatry. ADHD assessment process usually starts on by with filling certain forms and questionnaires and that help in capturing some of the difficulties in different settings like school and at home. And I personally do not prefer to go through the results of these forms and questionnaires before I sit with the child or the parent, simply because that stops me from being open-minded and uh, possibly makes me a bit judgmental. So I would prefer to see these forms and questionnaires after I meet the child and the parent during the conversation. And the conversation or the assessment typically would last around 90 minutes, around an hour and a half, when I get the opportunity to observe the child, to talk about the child's difficulties, and elicit the developmental history and all other aspects as relevant from the parents. I usually also take the opportunity to observe the child alone in absence of the parents if that's an option and if they are willing to go for it, and then have a joint assessment with the child and the parent together. And this is usually followed up by some other forms and questionnaires, which I think is appropriate. And then once I receive all the information, I sit in to compare the information that's been collected from the school, from the parents, from the child, from what I have observed during the clinic, and all other relevant aspects of the history. And I try to bring it all together and then decide, is this ADHD? Is this not ADHD? If this is not ADHD, then what explains the difficulties? But our job doesn't just finish with making a diagnosis of ADHD or something else. It's more around trying to identify ways how we could potentially help you, be it medication, be it therapeutic inputs, be it making some adjustments at school. So I usually follow this up with the feedback appointment where I sit in. This could be done remotely as well with the parent and the patient to explain my thought process, how I came to the conclusion, and what my recommendations are to help the child. And this is usually followed by a detailed assessment report for ADHD, which I do share with the parents. I usually encourage them to share the report with the school as well, so that the necessary adjustments can be put in place at school. And then we agree on how do we proceed forward with regards to medication and other therapeutic inputs.